Hello, everyone. Thank you and welcome for joining us today. You have joined a webinar for Laser Skin Surgery Center of New York with the esteemed Dr. Robert Anolik. I'm very excited to have you today. Dr. Anolik will be speaking about beauty above and below the mask, Botox and beyond. So I see a lot of you joining right now. I'll just give you all a few minutes to get situated. And while you're doing that, I'd like to tell you a little bit about Dr. Anolik in case any of you are not already familiar with him. So Dr. Anolik is a very celebrated board-certified dermatologist specializing in cosmetic dermatology, namely fillers and lasers. He's also a professor of dermatology at the NYU School of Medicine. You may have seen Dr. Anolik before because he is all over the TV and media and magazines. So he's had tons of recognition, everything from Elle, The Today Show, Live with Kelly and Ryan, Harper's Bazaar, Elle, New York Times, Allure, Vogue, you name it, I could go on forever. Best of all, Town and Country called Dr. Anolik the Michelangelo of Botox and fillers, which we love. He's also on New York Magazine's Best Doctor list, and he's also known for treating some very famous faces. The ones we are allowed to share include Kelly Ripa, Christy Brinkley, Ellen Barkin, and Stephanie Seymour. So ultimately, we are very happy to have you join us today, and thank you so much, Dr. Anolik, for taking the time. So again, you guys have joined the Beauty Above and Below the Mask, Botox and Beyond with Dr. Robert Anolik. So hi, Dr. Anolik.
Hi, thanks so much for having me and thanks for that great introduction.
Of course, I know you're probably embarrassed, but I'm sure everyone has seen you.
You sound like my mother speaking.
Great. Well, I see a few people still joining, but I think that we should get going because you have a lot of really great information to share. Right before
Sure.
Dr. Anolik starts, I'll just tell everyone that he has a lot of information to share. We are recording this, so you can always access it later if you want to go back and relook at something or rewatch any of the information. It will be available on Facebook, our website, and we will send you a recording via email. If you have any questions while Dr. Anolik is speaking, I encourage you to use the Q&A button that should be on the bottom of your screen, and as much as we will try to answer as many questions as we can at the end. So without further ado, I hereby give you Dr. Robert Anolik.
Thank you, Risa, and hi, everybody. Welcome to the webinar. It's a pleasure to be participating in this. When I was thinking about what I wanted to share, I thought I'd talk about the world that we're in right now and talk about beauty above and below the mask, the importance of beauty, Botox, and other strategies for keeping ourselves beautiful in this era. It is a strange time right now with COVID out there. I hope everyone's safe and healthy and staying safe and wearing a mask. It has been strange, certainly in New York City where we're located. We did shut down my part of the practice for a few months, although we were available for essential medical needs. But for my cosmetic side, we were closed for a few months, and I didn't know where things would go and how things would look when we returned. And now that we're back, I wanted to comment on some of what we're seeing and the attitudes that people have and what people like to do. So let's talk about it. So let's get started. So I just wanted to let everybody know that I am on Instagram. So while I'm sharing a lot of information here, I continuously share information over Instagram. So if you're on social media, please take a look at me there and follow us. Okay, hope you're all well. Here we go. So who are we talking to? I wanted to speak to everybody about beauty above the mask. I hope everybody out there is wearing a mask. So this talk is for you. Who we're not talking to, people who are not wearing their masks properly, and I hope everyone does. I took these images from the CDC and I enjoyed looking at them. So please don't wear your masks like this, wear them properly. So now that we're wearing a mask, our cosmetic concerns above the mask are completely emphasized. So there's no longer a distraction from a beautiful smile or that great lip gloss. Everything that's above the mask is being emphasized, and it's most of the takeaway that people have when you see people out and about. So I want to talk about how we're addressing those. I also want to talk about how our cosmetic concerns below the mask are hidden. So if people have been thinking about doing procedures that might have some social downtime, now has been a very popular time to take a look at that. So the areas below the mask are hidden if downtime is part of the treatment. What are the attitudes out there? for having procedures with masks and when we're working from home? Well, we did perform a survey, and we're going to be publishing this data in a larger paper coming out soon. But what we did learn is that about 23% of people out there are even more interested in treatments, partly because of the ability to hide healing areas under a mask. And 30% of people surveyed are even more interested in treatments, partly because of the ability to stay at home afterwards or work from home afterwards. I also personally feel that if there is something we can do to make ourselves look and feel better in a time when we want to look and feel better because the world is upside down, this is something that is safe and effective and fun that we can all do. So it's part of the reason why the practice has been so busy. So I am not violating a HIPAA here. This is not a privacy breach. Dr. Anthony Fauci is not a patient. But I wanted to put him up as an example of somebody who consistently wears a mask and to address what it is that we consistently see. So with masks on, those wrinkles right in the middle of the face, front and center between the eyebrows, are a big takeaway. We even subconsciously perceive these lines and the textural change as a sign of age. We see the same thing on the sides of the eyes. We see the same sort of furrowing on the upper brow. We see the heaviness to a brow and the shadowing. We see some sun damage like wrinkles and sunspots. We even see the neck banding that shows up here. I point these features out as features that so many of us have. I actually think for his age, Dr. Fauci looks pretty great. The mask, on the other hand, does cover the lower face. So who knows? Maybe Dr. Fauci had laser resurfacing and lip filler before he testified to Congress. We wouldn't know because the mask is masking what's below. So let's talk about real life in our office. Botox, I always loved this cover of Time magazine that came out not long ago because Botox seems to be jokingly a cure-all. It treats so many different things. We learn about new things that it can do that are helpful. And in the time of COVID, it's actually been one of the most popular treatments for kind of helping with the blues of not looking our best while we wear a mask. So it's been one of our most popular treatments in this time, and we've actually seen a spike, if that was even possible, in interest in having this done now because of the emphasis above the mask. So this is what I just said, that it does treat the areas above the mask, but I also want to emphasize that bad Botox is even worse when it involves the only visible area. So Botox is predominantly used on the upper face, and that is very visible. So if people are getting poor treatments done, it really can look even worse. So let's review how we use things like Botox to give us optimal outcomes in a dermatologist's office. I realize that many of you have had Botox, some of you haven't. So I wanted to show a demonstration of what it looks like to have a Botox treatment. So here's a brief video. So we think about facial anatomy when we want to really optimize Botox treatment, and it's not a plug and play. And unfortunately, we see so many bad outcomes by so many people out there because so many places are offering these sorts of things. But expert board certified dermatologists who specialize in cosmetic dermatology really can do this well. So when I look at a face, I think about the muscular anatomy of everybody, and everyone's face, while there's some similarities, there's always some discrepancies. So we really study closely what's going on. One of the most popular areas to treat is between the eyebrows. We often call this term the glabella, this area, excuse me, the glabella, although many people just call it the frown lines. Medically, these muscles that we're targeting for these sorts of creases and wrinkles are the muscles known as the procerus and the corrugator supercilii. And Botox is able to relax those muscles so that they don't contract and make the lines we don't want. It's hard though. So if you treat a little too superficially or above where you should, it can lead to brow heaviness. If you treat too low, you can lead to eyelid drooping. So this is it's technically extremely difficult to get right, and you really have to study the patient's face, and there's ways that we do that in the office. Many people think that we're talking about the 11 lines that form just from the skin pulling together towards the middle. I emphasize to patients, it's not just the 11 lines that form when the skin is creased together, but it's the fact that the 11 lines form while the brow is pulled downward, which can make us look older and more tired and create that heaviness that I was emphasizing in terms of the shadowing on Dr. Fauci's brow. So when we treat this area, part of it is to get rid of the 11 lines and also to lift the upper face. This is an example of a beautiful young patient that we treated. You can see on one side is her face before she had any Botox, and then also without Botox, but trying to bring the eyebrows together. What I want to point out is that some of those 11 lines show up. This is a young woman, of course, so her 11 lines are not wildly deep. But you also see that the upper eyelid, I don't know if you can see the mouse. Can you see the mouse on my computer? This sort of skin comes downward. So it's a little heavier here than she wanted. And when we bring the eyebrows together, it gets even heavier. That's an important point, how we're able to address that and open up the eye. So here, after treatment, while her face is at rest, you can see that the shape of the eye is more youthful and rejuvenated, even on a young person. So if you'll notice, her brow position is higher than it was in the previous picture. And you can see more eyelid skin than you can see in the previous picture. So the eyes look more rested, more rejuvenated, and she is not able to make those frustrating 11 lines between the brow. I can tell you, if you can't make a deep 11 line, you will not look artificial. There are things that can make you look just terrible when Botox is performed, especially when too much is performed. But in this area, you can really have a beautiful rejuvenated appearance by treating this area properly. This is another example, but in an older patient, where you can treat that area. Not only are we eliminating the 11 lines, but the shadowing that's right below the brow is markedly improved as well. We often take a look at what are called crow's feet, or the lateral part of the eye. These are fibers of what's called the orbicularis oculi muscle. Again, we look for where this is being contracted. We want to maximize the outcome, not just for wrinkles, but in terms of the direction of the skin. The skin comes together, that brings down the brow, which makes us look older and more tired. There's a lot of nuance here too. I put down a couple more colorful dots here to show I look for certain creases below the eye and how I can maximize lifting, but there's certainly no plug and play process here. But again, idea being relaxing some of the deeper creases, not just because it's nice to not have those lines, but also if we keep holding the skin, you will get permanent lines. And I want people to understand this does not make you look inanimate of line texture changes here just for natural smiling. So you don't have to worry about looking frozen by being treated there. Moving on to the forehead. Treating the forehead is probably the most complicated area to treat because it's very easy to get asymmetries and brow heaviness. So we look for key areas on a patient. Here's somebody who did very well on her forehead. I can say that when we do this, yes, the lines are a lot softer, but they can still raise their eyebrows so that they look natural. But I can't show that unless I show you a video, which I'll try to do in the next webinar. So there are a lot of mistakes out there. One that really drives me crazy, because I see this on patients who come in to see me after they have had procedures elsewhere and they wanted to know if it's looking right. Treating in the bad area in the middle creates those spocking of the brows. I think there's really an appreciation and so many subtleties that are needed, but these are really, I think, bad outcomes in terms of someone's Botox treatment. So if you're seeing things like this, you're just not at the right place. And if it's a fluke and somebody is excellent who's treating you, just go back and have them at least correct this so you don't have this look for many months. And this certainly would be amplified in someone's perception of you if you have a mask on and that's all that they see. I've been doing a lot more bunny lines because they just peek right out above the mask. This is what I'm talking about. We're able to soften those quite nicely. And something that I think most people who come to see us who have never seen us before, I'm surprised still are unaware that off-label we can use Botox to treat bands in the neck as well, because these are muscle bands pulling down, creating a less attractive neck. We can relax that skin really nicely with proper placement of Botox. This is just demonstrating some of the very common areas that I do treat, but again, it's not plug and play, and I really have to think through where I'm seeing motions, what we can relax, what we can to make sure you look beautiful and natural. So I've been asked, Dr. Anolik, won't I look too frozen with Botox and a mask? Well, my answer is very similar to it was before the mask. I say no one should look frozen from Botox, with or without a mask. And if you're relying on lower face movement to look natural, then you need a new dermatologist, all right? So what else is on the rise now that we are wearing masks? Something that might be a little counterintuitive is lip filler. Why is this counterintuitive? It's covered by the mask, so why would somebody think someone would jump to that? The reason it's been so popular is that when you put a needle in a lip, it is not uncommon to get swelling. There is a term called fat lip. If you bump your lip, someone has a fat lip, or punched in the face. That doesn't happen to the nose or the ear. The lip swells very easily. So people had to strategize more before masks to find the right time to get lip filler done. Nowadays, if you have some swelling for a few days, what's the big deal if you can cover it when you're out in public? So let's get a sense of what it looks like to get filler in the lips.
Dr. Anolik, maybe you want to explain what's happening here because the audio is not, the music stopped playing.
Oh, the audio is not. Okay, sure. So what I demonstrated there, it's about to stop. I'll tell you in a moment. Good. So what was being shown there was filler placed in the lip. We have a number of strategies using needles and using something called a cannula, which is like a needle, but it doesn't have a sharp tip. So we use a combination of these things to really optimize the placement in the upper lip. Obviously, that was a beautiful young woman. She needed very, very little. But the aesthetic right now for some people is to give a little extra body to the lip. And I really emphasize to my patients that I will not make them look artificial. There are certain regions of the country where people are willing to go wild. I never endorse it. I don't like it. In fact, I have an example here. Here's a young woman who was bothered a little bit aesthetically by the size of her lip, and she wanted to have a little extra softness. And I think that we very successfully treated her lip in a way that looked beautiful and natural. And there's no way she walked around where somebody thought she had lip filler. And when I saw her back for other things, she agreed that this looked completely natural. Here's another patient where we treated her lips. And again, we were able to give her some subtle body. It was exactly what she was looking for. And we made sure that she didn't look artificial. Risa, are you able to hear me? Okay, yes. Good. So let's move on beyond lip filler and Botox to the upper face, which we're doing a lot of. I want to think outside the Botox. That's a little pun, of course. Let's think outside the box. There are other things that we do with Botox. I just wanted to mention one of them. I'm joking that we're using Botox for what people are experiencing called maskne. People are getting redness and acne breakouts on the lower face. It is true that acne theoretically might help with some oiliness and some acne, but I mentioned this more for the redness that people are experiencing on their lower face from masks. And some people are referring to that as maskne. A colleague of ours published this paper of something that we've been seeing quite a bit, where the redness can be reduced by treating the skin with micro droplets of Botox. And this was just a picture. I hope this comes through on the PowerPoint slide, but redness was able to markedly reduce on the skin with micro droplets of Botox while we do our traditional full face Botox as well. But even though patients find this really interesting and we do it, I just want to emphasize that maskne is something that we are treating in terms of the redness, and we do rely on the gold standards, which is optimized laser therapy. Some people have never had laser therapy for redness, so I have a demonstration of what that laser, one of the lasers might look like that we would use. Here's one of the lasers known as a pulse dye laser, but I usually use a couple when I treat somebody. I like that last photo with the bright light because I'm wearing goggles to protect my eyes, but that intensely bright light is what is going towards the skin and directed at reducing the size of the blood vessels. But here's a great example of a patient of mine where I was able to make a marked difference in the skin to push away the background redness and the broken capillaries that were very frustrating. Usually my patients don't have this degree of redness. They're coming in just for cosmetic nuisances in general or now for maskne, but we can treat this quite successfully. So what about filler beyond the mask? Usually people think about filler in the lower face, the lips, nasolabial fold, the marionette lines, the cheek area, but this is supposed to be my demonstration of a mask, but the temples are often an overlooked area. So we do treat this very often, routinely, but now that we have masks on, it is something that we take into account even more, and there's greater interest. So this is what I mean. Here's a photo from a text that I borrowed where you can see there's a concavity. This is what I mean. I'm trying to demonstrate that sort of curvature that almost makes a skeletal look or an aged look to the face. And by injecting filler deep to those areas, you can make a nice rejuvenating change. And this area is clearly visible when you're wearing a mask. Okay, what about filler beyond the mask, besides the temples? Another area where I'm having a lot more patients ask for treatment is the hands. And again, this is an area that I love to treat, but I'm surprised how few people are aware still that we treat the hands routinely. And again, when your face is covered, people don't really perceive your age entirely, and this is a nice rejuvenated change. I also laugh at this photo because I do get a sense of timing here, because I remember treating her and she came back about a month later, which is why the bruise in her nail is coming down the nail. So it wasn't a medical concern, it was purely a bruise that would go away. And I also laughed that she was tan, because who goes to a dermatologist tan? But really the after photo here is almost like the hand of like the daughter of a grandmother. I mean, it really made quite an impact on her appearance. Okay, so beyond injectables, beyond Botox, beyond fillers, in this mask era, what are we seeing more of? Where are the spikes? Where's the interest? We are seeing a lot of non-ablative resurfacing interest. That means collagen stimulation. So things for fine lines and texture, and this is especially of interest above the mask, because we can do procedures that have very little downtime. So no downtime resurfacing. There's a number of options that we use to stimulate collagen, and one of the most popular, as an example, is the PicoSure laser. We helped develop this laser, I forget how many years ago it was now, 6 or 7 years, and we keep advancing with it as to how to use it optimally. But I want to show you, here's a demonstration of what it looks like to have the PicoSure laser perform to stimulate collagen. The patient is beautiful. She happens to be that model some of you may know, known as Jessica Hart. She's beautiful. Here's a demonstration. So you can see she was comfortable during that procedure, and the skin was just getting a little bit flushed, but it was very, very tolerable for her and afterwards as well. I just wanted to demonstrate what happens when you get lasered. There are distinct changes in the skin surface that promote a collagen healing and response that makes the skin more beautiful, and I frankly think more healthy. This is a microscopic slide of the skin. This is the outer part of the skin where my arrow is the epidermis, and down here is where the collagen fibers are. And this here is a little bit of almost like a little bubble that appeared in the skin surface. That sort of vibration of the bubble creates a signal response down the skin surface and tells the skin to make more collagen, which is why we see rejuvenation. Here's an example of a patient who was not being treated for rejuvenation, but for acne scars, which is remarkable that we can make an improvement with a patient having zero downtime. But we're using this primarily for rejuvenation. We're using it quite a bit in the mask era because we can treat all around the upper face, making the skin look better without downtime and without making somebody look silly with downtime above the mask. We're also using ultrasound quite a bit to improve skin quality. The reason that this ultrasound skin lifting strategies that we have, and there's multiple, have become popular is because we can use that all around the eyes to try to give an opening to the eyes, because the brow does drop as we age, and we can do these things with no downtime. There's two major strategies for doing this. There's focused ultrasound, which is known as Ultherapy, which some of you may have heard that name. And now there's a new strategy with non-focused ultrasound, and the technology there is called soft wave. I just want to give you a sense of how these work. When you focus ultrasound, ultrasound is a sound wave. It's a form of energy. If you focus that down to a point, it creates heat where it meets, which means there's not heat at the skin surface where the what we call a transducer sits on the skin, but instead the sound passes into the skin surface, deep to the surface, and creates pinpoint heat, much like a magnifying lens might do if you held it near sunlight. Here's a photo from one of the papers that was published when this technology was first going through studies and trying to get FDA approval. But you can see that this woman's brow elevated. It was only a treatment of the upper face, and it was a demonstration of safety and efficacy of lifting of the brow. And again, when we do these procedures, we don't see downtime. This is what it looks like as a schematic. That top blue rectangle is what is touching the skin surface. And there's blue waves passing into the skin, and that little red mark is the heat point. And we create multiple of these with the handpiece that we're holding. And that area of heat under the skin surface is called an exposure line, and that is what triggers the collagen change and the collagen tightening. We can actually visualize what's happening under the skin surface when we use ultrasound. This is a demonstration of that. That little green line called the exposure line is being highlighted there. So we know that we're in the right area and that we're not treating things that we don't want to be treating. And we do this while we're treating in the office. These pink bands that you see across the screen here, the top row demonstrates what the collagen looked like of somebody before they were treated with an ultrasound tightening device. And the lower row, D, E, and F, show what the collagen looks like after treatment. And the collagen is more organized, and the thickness of the collagen is greater, which are two things that will make us look rejuvenated. I love this picture. The top two, the top row, A and B, show elastic fibers that are somewhat disorganized. And the elastic fiber is what gives our skin stretch and recoil, which is a feature of youthful skin. And in C and D, you can see that the elastic fibers have been stimulated to grow, and they seem to be in parallel, which is something that's able to lift or pull the skin upward, which is what we're going for when we use these technologies. It even works on the lower face, of course, too. It's a nice demonstration from one of the medical journals. The latest ultrasound technology is known as soft wave, and this uses parallel waves. I just wanted to demonstrate what this looks like, which is all kind of similar to what you would see with whole therapy as well, to show that a patient can be comfortable while treated. So here's a demonstration of soft wave. So like the PicoShore laser, we're using the PicoShore laser for skin surface rejuvenation. We're using ultrasound technologies for firming and lifting. And the reason these are so popular above the mask is that there's really no downtime. You can have these procedures done, and for most people, you go out and about and the skin improves right before your eyes. This is a demonstration of what the soft wave looks like. Instead of being focused, the sound waves come out parallel and create a diffuse heat. And this is one of the results that we had while we were participating again in the clinical trials. For those of you who don't know, we performed so many clinical trials and contribute to the development of these technologies. And this was a great outcome on someone's upper brow, treating here on the upper face where you can see the lid heaviness. And 3 months later after treatment, the skin was elevated, which created more youthful appearing eyes. I want to touch on one other thing that I think is not as readily considered in general. And now that we're wearing masks and highlighting everything above, the little blue veins that appear underneath the eye are something that are bothering people, and people are asking about this. And it does make an impact on our beauty. Here's a photo of somebody who was successfully treated at our office. And I wanted to show you what's involved in a laser procedure like this. It can be a little strange for patients because we need to protect the eye when we laser so close to the eye. So we actually use little metal contact shields that we do have to slide underneath the upper and lower eyelids. So it's in contact with the eyeball itself. It's not painful, but it is a weird experience. So I'm going to show you a video of me treating somebody, and just take a look at their eyes. You'll see that I have the metal eye shields in their eyes to protect them. Okay, so what I was just emphasizing were the technologies that we're using above the face to perform things that make us look more rejuvenated with what's visible above, and knowing that that is visible to the public. So things that don't really have downtime and make an impact cosmetically. But now that we have the masks, I'm also noticing a greater interest in patients who want to mask their downtime, meaning things that might have evidence of treatment, scabbing or bruising or swelling, people wear the mask just like we were talking about with the lip filler. Well, that is true with technology as well. So let's talk about a few of those. Brown spots is a big one. Sunspots or brown spots are extremely frustrating for lots of people out there, but making the time can be challenging because you are left with a scab that could be present on the face for at least a week. So if it's on the lower face, you can have this done now without anybody knowing. So here's an example of a patient of mine. She had this brown spot right on her lower cheek. I wanted to show you what it looks like immediately after treating. So there are so many lasers we can choose from to treat this. And again, it's a luxury. We have so many lasers at our office. I chose for her a particular one called a Q-switched ruby laser, if I'm not mistaken. It could have been the YAG, but we have so many, I'd have to check the chart. In any case, we use the Q-switched laser. It makes the area look a little pink-white for a few hours, and then that turns into a scab or a deep pink mark that will be present for about a week. And then she came back about a month later for other things, and the spot was gone. So it was an entirely successful treatment. And in this scenario with a mask, you could have that done without anybody knowing. I wanted to demonstrate what it looks like to have this sort of procedure done. I have a video, I happen to be on the Today Show here showing it, but watch as I treat this person's hand, you'll see what it looks like to have this procedure done. There it is. Okay, so that's what it looks like to have a brown spot treated. The reason it's challenging is that we have to use right parameters, right lasers to make sure that the outcome is right to avoid complications. And then I also wanted to talk about more aggressive resurfacing. We mentioned the PicoShore laser for collagen stimulation, which is a gradual improvement with very little downtime. But there are certain lasers that we use that are what we call ablative. Ablative means wounding. If we wound the skin to stimulate collagen, we'll get a greater impact, but you will look treated for a period of time. It might be a week of scabbing and a month of pinkness, depending on what intensity we use. So I have been having a lot more inquiries about lower face ablative or wounding resurfacing, especially around the mouth. Here's an example of an ablative laser around the mouth. Picture, you'll see almost like a grid pattern on the skin. I like that image. It demonstrates that we are using lasers that are fractional. Fractional means that the beam of light comes out almost like little pixelated dots or dots on a newspaper print or pixels on a screen. What that means is we're not wiping the entire surface off of the skin, which we don't want to do because that could cause complications. Instead, we use fractional lasers, which are far safer. This is an example of what someone might look like after having a procedure like that. Obviously, they look different. They look treated. They can't just go out and about their normal activities. But if you have just your lower face treated, or especially the lines around the mouth, which are something that often want to be treated by many of my patients, you can have that done now and then walk out and about with me advising you as to how to do that safely, but without people knowing you had such an aggressive procedure performed. This is what the skin surface actually looks like after having a fractional ablative laser. And I'll bring out my arrow again. This is the top of your skin, and these are columns that are created by laser energy through the skin surface, and that triggers a healing phase where your skin responds by making new collagen and remodeling the collagen that you have. And the impact can be remarkable. Here's a demonstration from our office of somebody who had a remarkable improvement in the deep lines and creases on the face. So to conclude, I just feel that we're seeing greater attention being paid to no downtime upper face procedures, especially Botox, and more downtime procedures for the lower face. The impact of an expertly performed Botox treatment is even more impressive when we're wearing masks, but just as impressive are the bad Botox treatments. So make sure that you're going to the right dermatologists out there. I'm seeing a greater emphasis being placed on areas that often had a lower emphasis, even though I always consider them in the process. But patients are valuing treatments more to temples and blue eye veins and fillers in the hands as examples. And really, I can't emphasize this enough. I think most board certified dermatologists out there would agree that expertise is needed for optimizing results and most importantly for ensuring patient safety. So I hope that was helpful talking about beauty above and below the mask. And again, we try to share this information over webinars, but we also do use our social media to share this with the world. A lot of the videos that I showed here, if not all, have been shown in the past on my social media at Dr. Robert Anolik, and I plan on showing many more videos in the future. And you can always call us, contact us, and if we've never met you, we look forward to meeting you. All right, thanks so much.
Great. Thank you so much, Dr. Anolik. That was a lot of really great information and pictures. Again, I know a lot of you joined us after I did my introduction, so just so you guys know, this is recorded. You can go back and watch it again and relook at some of those slides for anything you missed. This is also the time of the webinar where you can submit some questions. If you have some for Dr. Anolik, we have a few interesting questions already. So at the bottom of your Zoom screen should be a little Q&A feature. That is the best place to submit them. Otherwise, like Dr. Anolik said, we are available for in-person consultations now and procedures with very strict COVID guidelines, so you can feel safe. We also can be available for virtual consultations as well. And then I know a lot of you might still be hiding out away in the Hamptons, so I wanted to remind everyone that we also have an office there. And every once in a while, Dr. Anolik even makes a little VIP appearance to see patients in Hampton. So let's get to the questions. So here we go. Here's the first one. Does Botox always work regardless of the age of the patient?
Almost always. And the reason I say that is I haven't met a patient where it really hasn't worked yet. And if you have lines that are created or creases that you don't need and they're a consequence of muscle contraction, then it will be helpful. I think it's important to emphasize that lines and creases that are permanent in the skin, those lines we cannot address with Botox. So if somebody says that something didn't work before and they come show me and they want to try it with us in our office instead of wherever they were, I really clarify ahead of time how it works and what we're able to treat. So I have patients who are very young. I have patients in their 90s. I laugh. Sometimes patients ask, when do you think I'll stop doing this? Not me, them, when they'll stop having the treatments. And I laugh with them and they laugh too, because I say, frankly, all of my 90-year-olds want to look like they're in their 80s. Yeah, these are cosmetic decisions. These are things that just make people feel good. And so I expect that we can make improvements at any age, and most patients love it.
Great. So here's a quick one. Is pulse dye laser similar to the V-beam laser?
Yeah, so the pulse dye laser is a category that is, there are different types, and the V-beam is a brand name for one of the most popular pulse dye lasers out there. And in fact, what I was demonstrating was a V-beam laser.
All right, here's another one. Does Botox help with the reduction of scars if it's done by an expert? Oh, and also, before we get to that answer, could you guys please take a screenshot of this contact information? Because I'd like to close it so you guys can see Dr. Anolik a little more while we're talking here. Please take a screenshot. Okay. All right, so now, does Botox help with the reduction of scars if done by an expert?
Yeah, I love this question because, as I mentioned, we are performing clinical trials constantly. I mean, I feel like we have a couple dozen usually going at any given time. We really feel that Botox could help with scars, and there's different ways we use Botox to help with scars. Existing scars, especially thickened pink ones, those are called hypertrophic scars. And there have been more and more papers being published, first out of Asia, and then we've been contributing a bit as well, looking at if and why Botox might help the appearance of a scar. But right now, there's a lot of anecdotal evidence published in medical journals showing that if you place Botox in scars, and this is off-label, this is not FDA approved or indicated, but we're able to have the luxury as dermatologists to use things off-label and try things, we are seeing improvements in scars. So I do have a few patients where we've been doing that and the scar appearance has reduced. But the most common way to use Botox to improve scars, this idea has been around for a while, is to use it preemptively. And what I mean by that is scars can heal better Well, a wound can heal better and make a more attractive scar if the skin that is being cut is relaxed when it's healing. So an example would be if somebody had a skin cancer or a mole or something frustrating right on the forehead, or let's say somebody had an accident or a child, they bumped their head. When the skin is relaxed, the skin heals better. If you're moving the muscle around, raising your eyebrows, relaxing your face, up, down, up, down, up, down, the scar will heal in a less attractive way. So we will often consider placing Botox in key areas on the skin when somebody has a wound on their upper face so that the scar is optimized, and typically it's viewed as more attractive.
Very interesting. Thank you. Okay, here's a great one. So this patient says, you do my Botox and lip filler fabulously. A year ago, I had a facelift. It wasn't complete without the CO2 laser under my eyes. I can highly recommend the CO2 laser to clean up underneath the eyes. Thank you for your expertise and perfection. I now see that my hands don't match my face, so now I'll be for my hands.
Well, thanks for that, whoever you are. I'll see you soon.
Okay, so what about fractional microneedling? Do you offer that?
Yeah, so before I go on that, I just want to mention one thing, that whoever that lovely patient was, they just had plastic surgery. I like to emphasize to all of my patients that I view four major categories or four major strategies for being able to improve our cosmetic appearance. Botox, to me, is a category on its own. Nothing else can do what it can do to make you look even better. Fillers do something that nothing else can do it. Lasers can do things that nothing else can do, help with stimulating collagen and brown spots and red spots. And then finally, surgery. Surgery primarily addresses laxity or hanging of the skin. So I love working with my wonderful colleagues who are plastic surgeons to be able to address things like skin laxity. Because frankly, when someone's skin laxity is improved by surgery, everything I do with my lasers, my Botox, my fillers, that looks even better. So we tend to work together as a team to optimize our cosmetic appearances. You asked about fractional microneedling?
Yes, fractional microneedling.
So I would suppose that any sort of needle treatment would be fractional because the needles are touching the skin as little pinpoint dots, and there's not a needle that would be big enough to affect the entire surface at once. I haven't been impressed by fractional microneedling or microneedling on its own much at all. Maybe I'm not that impressed because I find that what we're able to achieve with lasers is so far superior. However, I have been impressed by a method of fractional microneedling that uses pinpoint heat at the tip of the needle. So there are ones that use what's called radio frequency or a radio frequency current at the tip of the needle to create pinpoints of heat at the end of the needle. So there are a number of technologies out there that can do this. One's called Infini, one's called Genius. We have these at our office. We use these as a way to penetrate the skin surface with the needle. And then at the tip of the needle, the heat is able to stimulate a deeper collagen production than some laser might. So we do use those. We find those helpful, but I encourage people to consider the radio frequency fractional microneedling, not just microneedling alone.
Got it. Okay. Is ablative resurfacing helpful for marionette lines and depressions?
Yes, in general terms. Any sort of crease or line typically shows improvement when we use resurfacing, especially ablative because it's so strong. Usually a deeper crease in the areas that were just described, like in the marionette area, which is the area on the lower face here. Typically we would use filler to improve that more dramatically. But ablative is particularly helpful for deeper creases and lines here throughout the face to make an improvement. And our office published a study of depressed scars using ablative fractional resurfacing with really nice improvements. So yes, in general terms, yes, we can make those improvements, but usually a part of a combination of multiple strategies.
Okay, here's another one. What is the best treatment to improve fine lines under the eyes?
Yeah, who doesn't have that frustration? I say that partly because it is some of the thinnest skin on our body. and it does show wear and tear from sun exposure, and we're blinking constantly. So that does cause wear and tear. I find that one of the most successful and the easiest treatments that I use to help the under the eye skin texture and lines is Botox. So this is off-label, but on-label is using it in the crow's feet area, but I'll often take a look to see what's going on under the eye and how much the muscle contraction here is contributing to wrinkles and darkness in the under eye area. And if I see that, I make sure I treat that to smooth those lines. And if somebody misses that, so often what happens is that this area is treated with a smooth skin and it feels like the lines are amplified below the eyes. I can't tell you how many times I've had a patient come with a consultation and say that the side effect of Botox here is that lines appear here. And that's, I think, because whoever was treating them before wasn't thinking about what was happening here. So I would certainly consider that. But in terms of long-term improvement in those lines, absolutely, I would consider laser resurfacing. And often we would consider ablative fractional resurfacing, things like fractional repair, Cyton Pro Fractional. Again, it's a luxury. We have everything. We can pick and choose what makes sense for patients.
Okay, here's a great question. Do you have experience treating Asian skin? My doctor wouldn't do it because she doesn't have a lot of experience with Asian skin.
We treat Asian skin all the time. I had patients with Asian skin and black skin and Southeast Asian skin over the past week that I can think of off the top of my head. And they have beautiful skin, but they want to see improvement there too. It just made me pause for a moment because I wanted to show whoever asked that question. If you go to my Instagram at Dr. Robert Anolik and go to my post on February 12th, 2019, you'll see a beautiful woman, Asian skin, where we did some laser work to make the skin look healthier and more beautiful. So again, the February 12th, 2019 post on my Instagram, you'll see beautiful improvement on someone's beautiful Asian skin.
Yes, and definitely we treat patients with all different colors of skin.
Always. And I would also say, I understand why people ask those questions about different colors, different skin types. We do have to take that into account when we treat the skin because the skin is a little different in terms of how much pigment is at the surface. And we want to make sure there's no pigmentation abnormality just because there's interaction with the laser. And I do expect success when we treat people of all colors.
Okay, is there any downtime for treating those blue veins around the eyes, and how invasive is the procedure?
I would say the most invasive experience is putting the metal eye shields under the eyelids. We do put a numbing drop in the eye. We place the eye shields under the eyelids. But in terms of downtime, I don't expect it. The skin does look a little bit pink and blotchy for a few hours typically. If somebody has very sensitive skin, if there was some evidence of that over the next day or two, I wouldn't be shocked. But I typically expect people just to look a little pink and flushed the day of the procedure.
Okay, so let's see, there is a lot of questions coming in. We have time to get through a few more, and then okay. I encourage the rest of you to please make a consultation or you can interact with Dr. Anolik also on his Instagram account, which he has shared, and I'll pop in the chat as well. Okay. Ultherapy, I've heard, is very expensive and the results are subtle. Do you think it's worth it?
My jaw drops when I'm able to make any sort of lifting of the skin. I think we are making great strides, and I think it's impressive that we can do that. But I think it's only worth it if that's the mindset and the goal of the patient as well, because the changes are subtle. If somebody wants to have a dramatic change, when somebody has lots of laxity, then no, I wouldn't recommend that. And I'd frankly recommend somebody consider plastic surgery. But when the changes are subtle and a subtle improvement would be exciting, then I would say that it is worth it. And it's why we continue to do it quite a bit.
Great. And I want to remind everyone that we actually have 2 board certified plastic surgeons as part of our team. So if you do come see Dr. Anolik and he does recommend plastic surgery, it's very easy to, pull in and get you an opinion from a plastic surgeon. So let's see, what laser would you recommend for sunspots on the face and to stimulate some collagen? And how many treatments would I need, and how soon do results show?
Okay. Yeah, that's kind of a broad question. It depends on you. It depends on what we're treating. But a typical patient who has a few scattered sunspots, I often find it to be one of the most satisfying experiences for me and for patients, because we sometimes get a wow factor. More often than not, we can treat several of the sunspots and they are gone after the fact. Some can be stubborn, some may not want to go, some may require a few treatments, but so many times the spots are gone. In fact, that post that I mentioned earlier on my Instagram from February of 2019, there is a sunspot right on that beautiful Asian woman's skin right here, and it was gone after a single treatment. In terms of the collagen, we typically integrate treatment of sunspots with collagen stimulation. And that may be, again, fractional dual lasers, fractional lasers, and others. And I expect there to be improvement with just one. However, this, I think, is a relationship with my patients, and very often we'll continue that process, whether it's once, twice, 3 times, whatever we choose over the year, and continue to maintain the skin quality, the collagen quality.
Got it. Okay, what about fillers directly under the eye? Does it cause bruising for a lot of patients? And what does your office do to help reduce bruising in this under eye area?
Sure. So when I was giving my talk, I mentioned that the lip swells easily, and there's this term fat lip, because there's no fat ear, fat nose, it swells. That's why it's called a fat lip sometimes. Well, the under eye, there's a black and blue eye. There's no black and blue nose, black and blue ear there's a black eye. That's a term that people know because the under eye bruises very easily. So before I ever treat somebody's under eye, I make sure that they understand that they may very well bruise. They may very well not, but they could, and it could be significant, and they may have a black and blue mark there for the week, and they have to pick the right time to do that. I do want to emphasize to everyone out there listening that sometimes people consider under eye filler as a cure-all for any under eye frustration. And that is absolutely not the case. If there's pigmentation, we need to target the pigment with lasers. If there are blue veins, we need to use the lasers for the blue veins. If we need to stimulate collagen, we need to do that. And if there's a true hollow under the eye, absolutely. Placing very carefully, off-label again, filler under the eye to try to lift up the skin, we can make a beautiful change. Sometimes there's a little bit of a protrusion above the valley. They call that a festoon. In those cases, the amount of filler we put under there is really limited. Well, you can put as much as you want, but if somebody knows what they're doing, they're not going to put much in, because if you elevate a valley below a protrusion, that protrusion will just look bigger in the end.
Great. Okay, so here's a relevant question for right now. Can you tell us a little bit about what precautions you're taking to help in light of COVID when you treat patients?
So many. We ask questions in advance by phone to make sure that they don't have to be in quarantine. We wouldn't have them come if they had to be quarantined coming from an area of a hotspot. We take temperatures on arrival. Everybody's wearing masks in the office. I'm wearing a mask and a face shield. In fact, in those videos that you saw, I think you could see I was wearing a mask and face shield. We have plastic shields up, dividers. We have air filters in the office. And we have the luxury of being one of the largest cosmetic dermatology centers in the country. So we have many private rooms and people are not on top of each other. So there is social distancing from others. You can't be social distance from me. I have to get near you to treat you. But we're taking every precaution we can. And man, I have been tested so many times.
Yeah, most people say, you know, we've gotten a lot of feedback from patients that it's, you know, far safer coming to us than most anything they're going to a supermarket or all the other things that a lot of us are doing.
You're right. I feel very good about it. I think patients feel very, very comfortable and safe. And I understand the anxiety ahead of time.
So do I. Okay, here's a great question. My son had a hair transplant when he was 21. It left a significant scar across the back of his head. It's been 15 years since the treatment. Is there any effective way to reduce this scar?
It is really hard. I wish I could give a great answer to that because I've had patients come in with this exact question and show me their scars. You know, of course, you can grow your hair out in the back. That's the idea. When somebody has a hair transplantation, the idea is a strip of skin is removed from the back of the head, and then it is chopped up into little fragments, and those little individual hair follicles are placed on the scalp surface and allowed to grow. But that does leave a large scar, and typically we don't lose a lot of hair in the back of our head so that hair can mask it. But if somebody happens to have thin hair back there, it can be visible. Or if somebody chooses to shave their head, it would be very visible. So the only possibility would be laser resurfacing. If the scar is thick, injecting it with some steroids. If it's pink, and considering some of the lasers of the vascularity or the pink component. So I know it's frustrating. And the other last thing you could consider if it's really bad is scar revision and having a plastic surgeon or a dermatologist cut the area out and allow it to heal again, hoping for a better scar. Lastly, I would say, those of you considering hair transplantation, we still have those options in hair transplantation technology of removing a strip of skin. But nowadays, there's also some other technologies using robotic systems that can pull one hair follicle out at a time. The idea there being that you no longer have a strip of skin removed in the back that leaves a large scar. Instead, it's very fine ones that really would be not very perceptible.
Okay, great. All right, I'm gonna try and get in 2 more questions if we can before we get to the half-hour
Sure.
mark. So you mentioned the microneedling procedure with the heat for skin tightening. What is the typical downtime for that?
That is a little variable, but I do tell people that, some people may look pink and treated for 2 days. Some people may look like that for a week. But by and large, people look a little treated for 3 to 4 days, I would say. And if there is possibly in the week or 2 that follows a little bit of pinkness, a little bit of dryness, I wouldn't be surprised, but usually that wouldn't be anything that would be meaningful in terms of downtime.
Okay, a few questions here about how long does Botox last and how often do you need to get it done? And once I start, am I getting into a lifelong commitment?
I always laugh at that question.
Love affair.
It often turns into one because I fall in love with my patients and I hope they have fun with us. Is it a lifelong commitment? No. If you stop doing it, nothing bad happens. In fact, you're at a better point than if you had never done it at all, because of what I was trying to emphasize in part of my talk, which is that treating areas of the skin is preventative. People who you see who have deep creases here on their forehead or the crow's feet area that are permanent, that's a consequence of folding and folding the skin. If you have Botox treatment and it's done properly, you're not making deep creases anymore. You won't develop permanent lines as much. And so if you decide to stop one day, you don't have the permanent lines that you might have otherwise had. Botox typically lasts, we say, for about 3 to 4 months. Some people metabolize it more quickly and they only get a good 1 to 2 months out of it. That is really uncommon. But I tell people, expect around 3 to 4 months. It may be a little less in that 2 to 3 month window, but it's still having a nice effect. I do usually see my patients at about 3.5 month intervals because of the prevention that I was talking about. I want to retreat that area optimally, not giving you a window of time where there are deep creases that could ultimately lead to deep creases and lines. So I expect about 3, maybe 4 times a year, we take a look and take a look. I do think about my patients who have their hair colored, and I think, my goodness, they're there every 3 weeks. So 3 times a year is not so bad.
I agree. Okay, and very last question. This person is interested in lifting their eyebrows, and they're asking if fillers and Botox are better for that, or lasers, and what you'd recommend.
This is a combination approach. So when I was demonstrating the areas that we would target, and on the patient I treated with Botox, these muscles not only pull together, but they pull down, as does the top part of the lateral part of the eye pull down. So when I treat with Botox, I'm not just thinking of the lines that show up here, but how I can rejuvenate by lifting. So if you have that done properly, you should get a lift to your brow. Be careful that whoever's treating you with Botox doesn't put too much in the forehead, because if too much is placed there, the brow will drop. We combine this treatment with other strategies. We mentioned the temple filler. If that's particularly sunken, when that's brought back out, people feel a lift to the eye. And finally, I mentioned those 2 ultrasound technologies of soft wave, Ulthera. This is one of the most popular areas to treat, to reposition the brow a little bit higher.
Okay, great. All right. Well, thank you so much, Dr. Anolik. We crammed in 25 questions, so I'm glad we got those in. I hope this was useful for a lot of you. Again, this is recorded, so we will send this out. There's been a ton of great information, and we really appreciate your time, Dr. Anolik. I hope you all found this very informative and educational. If you are in and around the New York area, we would absolutely love to see you. Dr. Anolik is available, and we also have a full team of 17 board-certified dermatologists and plastic surgeons that would all love to see you. So Please call us, visit our website, follow Dr. Anolik on Instagram and the practice. And thank you again. I hope you all enjoy the rest of your evening. Thank you, Dr. Anolik.
All right. Thank you so much.
Bye.
Bye-bye.